I'm so pleased, I'm so happy to introduce my friends. The title of our next presentation is Oral Health Integration, a 40-Year Journey. Our presenters are Nicole Ferrian, she's the Clinical Innovations Director, Dr. Michael Helgeson, he's the Chief Executive Officer, and Deb Jacobi, who's the Public Policy Director, and all three of our presenters are from Apple Tree Dental. So, welcome.
All right, thank you so much. It's really fun to be here with all of our kindred spirits in dental public health and trying to create a brighter future for all the people who are facing barriers to care. Again, I'm Mike Helgeson, the CEO at Apple Tree and one of its 4 founders. Little preview of what I'm hoping you'll learn today is a little bit about our model, including interprofessional delivery systems and innovation teams. And this is a theme that I think has permeated some of the presentations so far today. And then understand some of the barriers to oral health for people across the lifespan, and appreciate examples of workforce and delivery system innovations that help overcome some of those barriers. So I'm going to start with this little video, which I hope you'll have fun with.
Oh no! I'm lost! Where's the line? It just went away. Dude, what do I do? Help! I'll be stuck here forever.
Do not panic! Do not panic! We are trained professionals. Now stay calm. We are going around the leaf.
Around the leaf? I don't think we can do that.
Oh, nonsense. This is nothing compared to the twig of 93. That's it. That's it. Good. You're doing great. There you go. There you go. Watch my eyes. Don't look away. And here's the line again.
Thank you. Thank you, Mr. Soil.
Good job, everybody.
So we're going to start with a little discussion about helping communities overcome barriers to oral health. And with that, I'm going to turn it over to Nicole Ferrian.
Good afternoon. My name is Nicole Ferrian. I am a dental hygienist and Apple Tree's Clinical Innovations Director. We are very excited to be celebrating our 40th anniversary. And today I'm going to be providing some background about our mission and vision, and also history. Our mission is to overcome barriers to oral health, and our vision is to foster partnerships that create healthy communities. At Apple Tree, we've never grown just for growth's sake. We've always grown in response to community needs. So we leverage our skilled teams and unique strengths to build sustainable community collaborations that help people of all ages and abilities achieve health and well-being. And just like a seed that sprouts, it takes time and the right process for healthy growth to occur. Apple Tree's model is called Community Collaborative Practice. Essentially, community collaborative practice is meeting people where they're at and using the help of community partners to increase access to dental care. Community collaborative practice is fundamentally an interprofessional practice model. It provides proactive oral health delivery to communities with high needs. We actively engage with other health, education, and social service professionals, and we integrate dental care into healthcare homes. Now I'd like to show you how we deliver care at a nursing facility. So we do not use a RV mode. We have a mobile equipment that is delivered in a truck. And so the trucks drop off the mobile offices in the evening and they're ready for use the next day. The mobile office enables our team to provide comprehensive care, including restorations and oral surgery for the residents. We can serve patients in wheelchairs or jerry chairs, as pictured here, or in standard dental equipment, whatever best meets those patients' needs. And when we're inside the nursing home, we can work directly with staff and other caregivers. Next, I'd like to talk a little bit about our team. Appletree's team is governed by our volunteer board of directors. As you can see from this slide, we have a wide variety of backgrounds and expertise to lead the organization. Here is a shot of how many staff members we currently have in our clinical team. As you can see, we highly utilize advanced dental therapists, and our greatest asset is our talented and compassionate team of clinicians. But I do want to call out advanced dental therapists and dental therapists because it is a newer model, and for those of you that aren't familiar with it, it is a mid-level practitioner in dentistry, similar to a physician's assistant or a nurse practitioner. We also have support team members, and they are truly valuable, not only helping make clinical care possible, but they play roles in education, innovation, and research. In total, we have over 285 team members. Across our staff, we've recruited teams with special expertise. Our teams have expertise in the following areas: pediatrics, geriatrics, special care, and public health. We offer IV sedation, oral surgery, and hospital dentistry services, prosthodontics and implantology, dental education, residency, and student rotations at our centers. We have staff that focus on fundraising and nonprofit development, and also public policy leadership and advocacy. We have 10 centers for dental health across the state of Minnesota. In this map, the green shades of color show that the population of patients we serve really come from statewide. As most of you have heard today and are aware of, there's an access to care issue in the state of Minnesota. And so while you can see there's counties that we are not a part of, we do see patients from all over the state. We also have 150 mobile sites, and we serve patients from all 87 counties. Last year alone, the impact of our program included over 108,000 dental visits, almost 39,000 patients seen, and more than $46 million in dental care provided. Here you can see our age distribution for 2024. We serve a lot of children, but then we also serve patients that are older, including 68 people over 100 years old. The value of services to Minnesotans has grown to more than $46 million each year. This slide shows where the patients we've served live. And over these 40 years, our mobile programs alone have provided almost 500,000 dental visits, served nearly 74,000 patients, and provided over $119 million in dental care. Total impact is shown here. So between our mobile and center staff, we have served almost 1.8 million dental visits, 200,000 patients, and delivered nearly $508 million in dental care. Now I'd like to talk to you a bit about Appletree's replications. Over the years, Appletree has responded to requests for help launching replication programs across the country, as shown on this map. Successful replications require the following: local leadership and resources, aligned missions and values, careful local program planning, and sustained local commitments. Thank you for your time today. With that, I'm going to turn it over to Deb Jacobi to talk about innovation and influence.
Thank you, Nicole. Many of the people at this conference and joining online have been our partners in our efforts to change the systems. So that's what this section, Innovations and Influence, are about. So I think I want to say, why would Appletree invest in change? Why would we not just put money into providing more care? And it's because from the beginning, the founders sensed that there were barriers that needed to be overcome. And it takes a lot of creativity and a lot of partnership to make that happen. It matters because there are so many changes that need to be made, but change is slow and sometimes daunting. The leaf and the twig get in our way on doing the things that we want to do. But it's also compelling to do that, to make those changes, because not only is dental care not available to many people, the inequities in oral health are really tremendous. So this slide, you've seen this different versions of this graphic, but I want you to see that it is about justice. It's about social justice and health justice, not just dental care. So we work together on system-level thinking about ways to eliminate ageism, ableism, racism, and socioeconomic barriers. To do that, we have 6 innovation teams, and we work together to discover, develop, and understand, and then share other innovations. All of these teams are necessary, and we work collaboratively together. Typically through a cycle of identifying a potential solution or innovation, piloting it, taking a small group of people who are interested in the change, then examining or analyzing the impact of that pilot, and then if it was successful, if it has promise, then spreading it throughout the rest of our clinicians. And we call this approach a learning health system, at the center of which is the community collaborative practice model that Nicole told you about. It involves delivery systems and how we're delivering care. It also involves research to look at what was the impact or to investigate the potential changes, and innovation, constant innovation. So again and again, these cycles to evolve our model. This slide, I want to shout out these 4 great leaders of teams at Appletree who are working on what you may have heard called minimally invasive dentistry, and we like to call optimal intervention dentistry. And this was an internal continuing education course that was developed. So for the non-clinicians, this is rethinking in the light of new evidence how we practice. And there's some examples of topics that were included or products that our staff were introduced to using via this learning health system approach. I also want to talk about a few additional innovations, teledentistry, and other innovative partners that we've worked with. So Appletree has been using teledentistry and evolving the use of it for 20 years. This is just to show you extraoral images and intraoral images of the patient and the mouth that are now part of our standard dental record. And part of this is for the way we operate. So let's say a collaborative practice hygienist is out at a nursing home or a Head Start center or school. They can capture these images, other data, other information at a location that is convenient for the patient, embedded in another facility that's providing health and social services, and then they can upload this to our electronic health record. An advanced dental therapist or a dentist can review that, and then our care coordinators can follow up with the family to say, here's what we found. And it's about workflow, it's about efficiency, it saves the family time and travel. First visit is either at a location that they are at anyway, and by the time they come to our practice, we know what they need, they're scheduled with the right provider, and our time is used wisely. With the waiting list for care at most dental practices, it's really important that we use those precious appointments wisely. This is called synchronous teledentistry, so what I just described, where the images are captured and then the clinician reviews them and a diagnosis is made. This is about synchronous, where it's happening live with the patient on the other end. And as you all know, the pandemic really accelerated the use of synchronous technologies. But we're finding that, just as I said before, this is a really great way for us to make the most use of our resources. So I'll give you a couple of examples here. One is that Heather Lubin, our advanced dental therapist, has become the triage queen of the pediatrics team. We get referrals every week from all across the state, from private offices, from other safety net providers and so on, about people who they believe will need to have OR care for their young child. And the beautiful thing is, in a live interaction with the family, Heather can learn more about the condition, why the referral was made, and so on. And frequently, she knows of another provider, an advanced dental therapist or someone in our group who can see that patient without that. If indeed they may need to see the pediatric specialist, then they are made ready for that appointment, and we've sort of slowed down the queue and unclogged the wait time. And they may see her first for silver-diamine fluoride or something while they're waiting for that specialty care. So faster care, better care, and more efficient on our part. I'm sure everyone is hearing lots about artificial intelligence, and we have a wonderful partnership with a company called Overjet. This is an image of an X-ray with AI annotation, just so you can see kind of how that looks. And when we implemented this at Appletree, we wanted to also know, as part of our learning health system, how are people understanding this? So we partnered with Overjet and with CareQuest. This is a publication that came out just looking at what did the providers and the patients feel about using this. And just to cut to chase on the results, provider confidence about using it grew over time with it, significantly, more than doubling the folks. And in these interviews that were conducted, it was really clear that the software helped not only make the diagnosis, but also to help convey to the patient, here's what we're recommending on your treatment plan, and this is how you can also understand it. So we shared work with the patient about that. And the next partnership is one that I'm very excited about with the Mayo Clinic. Dr. Ryan Demmer is a professor of epidemiology there. And for those not familiar with the Rochester Epidemiology Project, this image of the counties for which patients have their medical records. They consent to having their medical records used for research, and it's huge. In Olmsted County, it's basically 100% of the people that receive medical and dental care, pharmacy, inpatient, outpatient. All of their medical records are available in this database, and it goes on. The further out you get, the fewer. But it's an unprecedented database of medical and dental information. And we're undertaking a trial partnership with them. These are some of the folks involved in it. We're going to leverage Appletree's records and the Rochester Epidemiology Project to look at what would the impact of having good periodontal care be on individuals with pre-diabetes and periodontal disease. So there's lots out there already that shows that if someone has untreated dental disease, has periodontitis, that their diabetes control is much more difficult. So that's that oral systemic connection. But what we're working on now will be to look at what this means for people who are at high risk for future diabetes. And it's kind of a complicated graphic there with a lot going on, but it is well thought out, and it takes on a number of challenges and aspects to this. And I like what Dr. Demmer said about this, was that if we see what we think we're going to see with optimal periodontal care, and pre-diabetics don't become diabetics, that we may need to, here's the understatement, we may need to reimagine the best interventions and the optimal windows for these interventions. So to me, that's medical dental integration, is figuring out what these are and then developing a practice paradigm shift. So, and my part at Appletree is to help advocate for system change. So just quickly, a few slides about that. And before I came to Appletree, they had already been doing tremendous work on long-term care regulations, being sure that people living in nursing homes actually, that their oral health was attended to. Various things with public programs and Medicaid reimbursement, including founding a program that has kept many of the critical access dental providers solvent. Expanded functions so that more of the dental professionals can do more things. Collaborative dental hygiene practice so that hygienists can be out in the community, not just inside the operatory. And Minnesota being one of the first states that has licensed a new mid-level called a dental therapist or an advanced dental therapist. We work, again, in partnership with many, many people. And I just wanted to put up a plug for the Association of Critical Access Dental Providers of Minnesota, CAD Minnesota we like to call it, and it really is about aligning what the state pays to what the value is to people, so that we are supporting this network of providers and we're actually improving health. There is a recent InfoMar by the Oral Health Coalition available, and the link is there for those that can access that, or go to the website and find this InfoMar, where Dr. Helgeson and Dr. Sheila Riggs tell a great more detail about that. Another one, a national network that if you're interested in medical dental integration, it would be worth your going online to look for, is called the Oral Health Progress and Equity Network. And this is a group of individuals and organizations across the country that are quite passionate about ending oral health inequities, and it includes organizations like Justice and Aging, Families USA, Community Catalyst, and CareQuest, and it's a great place to network and find resources. And finally, another plug. Nancy, I just realized when I was getting ready for this that we're halfway through the state oral health plan. And I need to go back in and look at the medical dental integration metrics and find that. But if you didn't know, we do have a state oral health plan. It was developed collaboratively by Nancy and Prashita and others, and it is chock full of information where you can see other ideas and ways that we can integrate medical and dental care. And with that, I am very pleased to turn it back over to Dr. Helgeson.
All right, what a team here. So I'm going to talk a little bit about organizational strength and sustainability, and really focus that on the community partnerships. It is really the community partnerships that create that strength, along with our employees, and supporting and developing our employees. And again, community partnerships generate interprofessional innovations, and interprofessional is a big theme, so I'm going to talk about that. Really working with bankers and teachers, and it's not just medical dental, it's the community, and it's really thinking about all the folks that are out there. And it really, our longevity and celebrating 40 years is a kind of a fun milestone, but it really is about using those interprofessional collaborations from our board and recruiting. We don't have a board of dentists. We have a board of community leaders, people that are influential in different sectors of the community, and that helps guide us and give us ideas. And then we have extraordinarily diverse community partners, ranging from long-term care to schools and preschools to jails to behavioral health institutions to rural hospitals, on and on. Those collaborations are where we get the new ideas and where we get the support to raise the funds and all the other things that are necessary. So one theme is that whole person care goes beyond integrating medical and dental and behavioral and includes long-term care, all these other sectors. So I just want to open everybody's minds to that you can get great ideas outside of healthcare. Again, you saw that our mission is to overcome barriers to oral health. You notice it's not to provide access to dental care. I just want to highlight that. Barriers to oral health is interprofessional, right? We want oral health, and so the physicians have a role, and the teachers have a role, and so on. And then fostering partnerships that create healthy communities. That's how you get you have to have healthy water. You can't have lead in the water, right? So partnerships are really the key. It was already mentioned that our board of directors have interprofessional expertise in these different areas. And educational collaborations are also part of that. It's one thing to develop a good idea, but unless you teach other people about that idea, get your own staff to start to do it the new way. That's where you start. But then how do you help other organizations learn from the things that you've done? So these are educational institutions that we partner with on rotations of different types. And each year we have about 500 students from these different areas that do rotations of different lengths and experience different things at Appletree. And you'll see the usual dental suspects over on the left, but on the right you'll see nursing students and CNAs and PCAs. These are the hands-on caregivers for people with disabilities or in long-term care, even high school students. So we have a program similar to Hennepin Health where we're reaching out and partnering with high schools, and then we become like the family to help support diverse younger people that want to pursue a career in oral health, and we mentor them and coach them and help them apply for things and get grants and things along those lines. This is Dr. Ashley Johnson, who heads up the program I was just talking about, and just illustrating some of the work that she's doing, providing those mentoring experiences and learning and really helping people that might want a career in oral health to be able to successfully pursue that career. Interprofessional experiences are how you learn how to work with folks that aren't dental professionals. So if you're just in your dental office, that limits the range of who you can work with. But when you're out in long-term care, as you saw in a couple of those slides, you have an opportunity to work directly with the nurses and the physical therapists and the occupational therapists and other team members that are there. And in long-term care, we work with the nursing staff, and we write daily mouth care plans and teach the nursing staff how to carry out those long-term care plans. And in fact, that's one of the regulations in Minnesota, that they have to do that, and we had a hand in getting that into the regulations for nursing homes a couple decades ago. So these are some of the other kinds of things in long-term care that students have an opportunity to be exposed to. Special care dentistry is part of our genes too. I think we're the largest provider of services to people with disabilities in the state, and we get to work directly with behavioral health professionals, both on-site in their group homes and when they come to our settings. We're involved in mental health campuses, also structured work sites where patients with disabilities spend their days. That's their dental home. We bring the dental care right to that place where they're comfortable, and they've already made the hidden copayment I've mentioned before, where they're already there, they're already transported there, and they can get their routine care there. And again, reading through the examples there, you can see a little bit more of the kinds of experiences that are possible in this model. This is Dr. Cook, our Director of Pediatric Dentistry, who heads up our pediatric specialty care team. And they, as was mentioned, they receive referrals from folks all over the state. Sometimes people spending the night to have care there. And they provide not only care in our special care clinics where we have a medical anesthesiologist and nurse anesthetist of our own, but also in partnerships with other hospitals that we work with, including Hennepin Children's, Gillette Children's, et cetera, and then the 3 that we are co-located in. This is Catherine Anderson, our Director of Special Care Dentistry. Dr. Fawkes, another special needs dentist on the special care team. And again, they get referrals from all over the state for behaviorally complex patients, patients with persistent mental illness, patients with chemical dependency problems, and things along those lines. In our clinics, we have lots of accommodations. This is illustrating training using ceiling lifts that are built right into the operatory, so we can help transfer patients that are in wheelchairs into our dental chairs and be able to provide care that would be very difficult to provide in their wheelchair. We have a special care dentistry clinic there. And then I mentioned we have a couple of operating rooms of our own where we have the anesthesia teams there that work hand in hand with our teams, and we're able to do general anesthesia cases for children and IV sedation cases and so on for adults. And then we carefully work with our hospital partners for those patients that really need that extra level of having these services in the hospital. But last year alone, these teams provided over 1,000 cases just at Mounds View. And we do these at a couple of other sites. And each case saves someone in Minnesota at least $10,000. So that's $10 million of value added. And these are folks that would have waited months or years to try to get into a hospital for general anesthesia. So this is a really great way to provide better special care at a lower cost. This is just a little quickie video where you get a little snapshot of what that looks like for the team. But being able to have operating rooms that are optimally equipped for dental actually makes it easier for our teams to do better care. We can do all kinds of restorative care in those operating rooms. Often when you're in a hospital, the room you're in really isn't optimal for dental. You know, they've got a few dental things in there, but it tends to make you want to do the if in doubt, pull it out treatment plan, which is a terrible treatment plan, frankly. I mean, who would sign up? I want to, if in doubt, pull it out. I don't think anyone would sign up. But when you wait 5 to 7 years to go to a hospital operating room, and you don't have a system for providing prevention, you get that radical treatment plan. And in this model, we don't have to have that radical treatment plan. We can have a much more patient-centered experience. This is just kind of a visual of one of our centers that are co-located. This is in Little Falls in St. Gabriel's Hospital, where we're located right alongside medical primary care in a critical access rural hospital. And this again provides opportunities for us to have medical dental integration. We're also in the Mayo Clinic. We're the dental provider in the Mayo Clinic down in Fairmont and in the hospital in Madelia. And so medical dental experiences occur in these settings, including working with the various departments within those rural hospitals, exchanging electronic health information and so on, and making bidirectional referrals. This publication over on the right is about innovations in oral health and primary care integration, and Appletree was part of the group that created this, which is, it's a fabulous publication if you're interested in that topic. It's really well researched and really well written. So with that, I'm going to wrap it up and thank you all and invite any questions that you might have.